sounds like a lot, and it is, but do not slam it. It needs to go IV piggyback into a 100 bag. Okay, so put however much you're going to give into a 100 bag and then drip it in slowly over 20 minutes. All right. Impending failure, you can give epi-IM. If they're less than 25 kilograms, you give 0.15. If they're greater than 25 kilograms, you give the full 0.3. Foreign body aspiration. So suggestive history, big thing with this one is going to be an acute onset of stridor or respiratory distress. Okay. Age does not really matter in this. All right. We've seen kids who have inhaled like jewel pods. All right. So yes. But no recent upper respiratory infection signs, no fevers, no history of asthma. All of these can be signs of all of a sudden having an acute onset of stridor. It could be a foreign body aspiration. Suggested physical exam. So when you're listening to their lung signs, they may have a cough, they may have just stridor. Chris Wachowski mentioned last class that he had a kid with a foreign body airway aspiration who had no stridor, but he had a change when he turned his head to the left. He'd be completely fine if he was facing straight up, and he had a coin that was lodged this way, but as soon as he would turn his head to the left, the coin flipped, and the kid would turn blue and not be able to breathe. But as soon as he went back straight again, he went back to normal, okay? It looked like this. This is a Canadian dollar. This kid was saving his quarter in his mouth. I don't know why they do that, but a lucky charm. But this kid was lucky because it lodged this way. What would happen if the kid lodged this way, right? That's not good. All right, it's a full airway obstruction. Give the hymen. So 20% of airway obstructions actually lodge in the trachea. Everything else actually lodges in the bronchioles. So just because you don't hear stridor does not mean that they don't have an airway obstruction. They may be wheezing, okay? Something like this child. Does anybody know what that is? What is it?
One of those connections.
The Tinker Toy?
Yeah.
What if I told you that they were just putting together something from IKEA? You are correct. So the kid just inhaled it and it got lodged in one of his bronchioles. Okay? So this kid had a history of asthma and they did a bunch of albuterol and it didn't work. He was still wheezing. They had no other symptoms other than that. So they brought him in and this is what they found. So, in an emergency for a foreign body airway aspiration, first thing, use your weight-based charts if you need to, if you're going to give something to these kids, like for sedation, for airway management. However, most of the time, just keep the kid calm and get him to the hospital if it's a partial obstruction. If it's not a partial obstruction, it's a full one. We need to do the Heimlich on anybody who can stand or above. Anybody less than that, you do back blows and chest thrusts. Until they're unresponsive, and you just go straight to CPR. When you're doing your assessment on these kids, back to old school CPR, look, listen, feel, right? First thing, look, do you see anything abnormal in this child, okay? And that includes your retractions, your chest wall movement, cyanosis, deformities of the trachea. All of these are, all of these are things that you can see, all right? The next thing is listening. You have to listen to these kids, all right? All the way up and down their back, not just the front. Any noisy air sound, any noisy breath sounds whatsoever is not normal, okay? Unless you have a STARS form that tells you that they have coarse lung sounds at baseline, or if mom tells you that they always have coarse lung sounds, that is not normal in a child, and you need to fix it. Then you're going to feel, okay? So, especially in a kid, which Trish will talk about here shortly, and a kid with a trach, okay, sometimes they have false trachs, so you have to make sure that the trach is actually in the trachea, because sometimes it doesn't go into the trachea, but it still goes in the skin. What happens if you put air underneath of the skin? What do you get? Subcu emphysema. What does that feel like? Rice Krispies, okay? So feel around their airway as well, all right? So these are the absolute indications for trach intubation, which again, you can also move this into some type of an eye gel. But respiratory insufficiency, GCS of less than 9, and these are the children's recommendations. I don't necessarily think that you have to intubate all of these children, especially if you're by yourself in the back of a truck bouncing down Kings Highway. It's not always the best attempt. As Adam Hager likes to say, make your first attempt your best attempt. Right, Adam?
That's right.
Thank you for your service. Any severe injury, though, what I would say is a predicted clinical course. If you see a kid who's headed downhill and you think potentially you will have to, then I would pull the trigger. I don't want you to do that in 10 minutes when you're sitting outside the hospital when you have no help. Do it when you have help. Okay. Does anybody have any questions? Thank you, Adam.